Welcome to the SHSMD webinar, Online Communities, the next must-have social media tactic. SHSMD would like to extend a sincere thank you to LiveWorld and Mount Sinai for sponsoring today's webinar. Now it is my pleasure to introduce today's presenters. Danny Flamberg is a senior marketing strategist and practitioner who has been a pioneer in crafting compelling strategies, devising breakthrough messaging, and embracing omni-channel thinking about broadcast, digital, video, mobile, and social media to support leading and insurgent pharmaceutical and life science brands. For 7 years, he served as EVP Managing Director of Digital and CRM at Publicis, working on Pfizer, Merck, AstraZeneca, AbbVie, and Sanofi brands. Prior to joining Publicis, he led the digital transformation of Juice Pharma advertising. As Director of Digital and Social Media, Chloe A. Politis oversees all strategic, operational, and financial social media related activities for the Mount Sinai Health System. Chloe has a BA in English from Fordham University, an MA in Health Advocacy from Sarah Lawrence College, and a certificate in digital marketing from Columbia University Business School. Under Chloe's leadership, Mount Sinai has maintained a top ranking in social media for healthcare systems in the New York metropolitan area for 8 years. Chloe leads a 4-person team that consults on the social media efforts of more than 200 departments. She's active in the broader industry as a member of the Forbes Communications Council and a Forbes contributor. When Chloe is not on social media, she is volunteering as a Braven leadership coach to empower first-generation college students like herself, with the skills, confidence, experiences, and networks necessary to transition from college to strong first jobs, which lead to meaningful careers and lives of impact. Danny and Chloe, the floor is now yours.
So hi everyone, really excited to be here today. So today's presentation, we're going to discuss caregiver marketing, the state of dementia care, the benefits of online communities, our program's roadmap and implementation plan, and lastly, our results. So before we dive into online communities, I want to provide you with some background information on the Mount Sinai Health System. We have over 42,000 employees, which include more than 7,200 physicians and specialists. We have 8 hospitals and a medical school and over 400 community locations, so you can access Mount Sinai care in New York and beyond. And 38 institutes focused on multidisciplinary research, educational, and clinical progress.
So our mandate was twofold. Number one, it was to find a marketing tactic that would be differentiating for the Sinai medical system and give us a competitive edge. It also, the second part of the mandate, though, was to find an underserved population that we could provide genuine service to in using our skills and using our experts. So we landed on dementia care for a number of reasons. Next slide, please. There are 13 million dementia patients in the United States at any given time, and as the baby boom ages, there's a new diagnosis every 3 seconds. There are 11 million unpaid caregivers in the United States, delivering 15 billion hours of free care. So when we thought about an underserved population, and we researched to several degrees and several different categories and several different conditions, we landed on dementia. Why? Because the current state of dementia care is, in a word, grim. There is no standard of care. There is no cure for dementia. The symptoms and the behaviors of dementia patients tend to be idiosyncratic, so there's some commonality, but not enough to make a difference. And the burden on caregivers is taxing in many different ways, primarily twofold. Number one, they are trapped in a sandwich generation, taking care of children and adult parents. And number two, there is the emotional, financial, logistical, and practical implications, which are taxing, challenging, expensive, and difficult to manage. So these two ideas, find a marketing tactic, online communities, find an underserved population, and marry the two together, was the origin of this program. Next slide, please. When we think about the current state of caregiver marketing, we're also thinking grim. Next slide. So there's a lot of information out there in the marketplace. It's a mixed bag of information. There's good, there's bad, there's ugly. In many cases, they're making it up as they go along. One of the things that we looked at as we researched this market was the idea that they were missing some authoritative, they're missing authoritative sources. They were missing clinical interventions. They were missing a trusted source of vetted information. And we felt that we could provide that information leveraging the geriatrics team in Mount Sinai, which is ranked number one in the US. So we landed on the idea of using these people to guide our solution, and the solution was a caregiver community. Next slide.
So Danny, now that you've identified obstacles within caregiver marketing, it's now time to reveal the solution, the caregiver community, to our audience today. Next slide, please. So we chose to design a private Mount Sinai branded Facebook group, Navigating Dementia, a Mount Sinai Health System community for caregivers, in collaboration with our Department of Geriatrics and Palliative Medicine, to provide caregivers of patients living with dementia the resources needed to get through challenging times, as well as access reliable and accurate clinical information. And through this forum, group members can connect with our geriatricians in real time through Q&A and video chat sessions. And additionally, they can connect with other group members and engage with one another through shared experiences. Next slide, please. So as we worked on designing the group, we simultaneously worked on our member recruitment tactics. And although Facebook groups can rely heavily on organic growth alone, we knew that in order to reach the right audiences to join our group, we had to get the group itself in front of the right people. So our recruitment tactics included organic social media posts on Facebook, Twitter, Instagram, and LinkedIn. We posted on the main Mount Sinai Health System social media channels, as well as the Mount Sinai Brookdale Department of Geriatrics and Palliative Medicine social channels. And the great part about having a social media presence for our geriatrics department meant that we were going to target very specific audiences, such as referring physicians and geriatricians within our department, to promote the group on their own social media channels. And another tactic we used were paid Facebook ads. Unfortunately, you cannot drive group membership directly like you can with page follower ads, but we were able to find a workaround, and we tapped into our email marketing resources. The Facebook group was promoted via patient and physician e-newsletters, as well as an internal email within the Department of Geriatrics. We ran display ads, which drove traffic to an interstitial page that we designed so that people can learn more about the group and its resources and see if it's a good fit for them. And now I'm going to turn it over to Danny to share the user experience.
So we knew, next slide, please. We knew that this entire program would live or die on the basis of user experience. So we spent a huge amount of time thinking and strategizing about creating the appropriate, safe, protected user experience. And we had 5 lines of attack. First, we started to figure out what do we want the tone, the tenor, and the content of this group to be like. And we used the TFD formula. We asked ourselves, what do we want members to think? What do we want members to feel? And what do we want members to do? And the answers were, we wanted them to think that this is an incredible, valuable resource that they should think about and use. We wanted them to feel like they'd finally found their people, that they were now connected with others who were going through the same experience, experiencing the same emotional and physical traumas, and would be sympathetic to their needs. And we wanted them to come to the community, share their information, react to what was going on, consume the research. So the TFD strategy formula was step number 1 of five steps. Step number 2 was to think about KPIs. We knew from our experience in community building in other contexts that generally the 1-9-90 formula was the indicator of engagement, that 1% of the audience would be active, that 9% would be somewhat responsive, and that 90% would be mostly observers and occasional participants. So we set that up as a goal in terms of the way we could construct engagement and the way we could measure the engagement and the activity in the community. Number 3, we thought about who we were dealing with, and we thought about a New York kind of attitude. And in New York, we have kind of a way of thinking about navigating the world. All of us have a guy. We have a guy who helps us with different kinds of things. We have a guy who helps us with technology. We have a guy that helps us with fashion. We have a guy that helps us with resource. And we thought, you know what? We want to create the kind of relationship where Mount Sinai becomes the guy in the area of caregiving and in the area of sympathy, in the area of true information. So number 3 of our 5 lines of attack was becoming the guy and changing the relationship between the hospital and the caregiver population. Number 4 was the idea that we wanted to insert expertise, that we wanted to call on our clinicians and our gerontologists. We wanted to be guided by them. We wanted them to be interactive in the community. We wanted them to be accessible to members. We wanted them to share research and answer questions. So providing that injection of expertise, of care, and of experience was number 4. And number 5 was the idea that we wanted to manage this actively. So we deployed an experienced community manager and gave her the authority to intervene, to ask questions, to clarify, to add information, to add infographics, to share videos, and to make a robust content play in the community. So these 5 lines of attack, the TFD model, the 1990 KPI, becoming the guy, inserting the gerontologists, and managing the community actively became the 5 ways that we could create an unbeatable user experience. And to give you a sense of how that worked, look at this video. So now that you've seen the video, you can begin to get a sense of the benefits of the online community to the hospital system and to the people participating. So on the left-hand side of the slide, we're talking about embracing caregivers. In the middle of the slide, we're talking about exchanging ideas and tactics and tips. Again, remember, there's no standard of care. Remember, everybody is making it up as they go along. Some people are successful. Some people have interesting ideas. And to the far right of the slide, we're talking about injecting expert information, clinical information, medical information. So the combination of embracing the members of the community, encouraging them to share, and adding expertise became the benefits to the online community, both for the participants and for Mount Sinai. Next slide, please. And the way that plays out for Mount Sinai is threefold. Number 1, it creates an emotional connection between an institution and an individual. And that's critical to the activity and to the behavior of participants in the community. Second, it goes beyond treating the condition and treating the full person, but it also changes the relationship. Most people have a transactional one-time relationship with a hospital. They need an operation, they need a scan, they need a test, they need a doctor. This changes that relationship not only to become the guy, but to become the trusted resource. So when they have a medical need outside caregiving, when they have a medical need for themselves or for their children or their neighbors or their family, Mount Sinai becomes top of mind. And lastly, it gives us a gateway to that medical care and to service line marketing. So that the benefits to the hospital not only gives us a unique marketing tactic, but it gives us a unique way to connect with patients and prospective patients, and at the same time deliver genuine value and genuine care. So now Chloe's going to give you a sense of how the community works on a micro level.
Thanks, Danny. Next slide, please. So we're going to start off with showcasing our roadmap. So the most important part was putting together a team that would be able to design and implement the plan successfully. This is why Mount Sinai teamed up with LiveWorld. Our team consisted of marketing leaders, social media strategists, brand strategists, content creators, and creative directors. So once we put our team together, it was time to come up with a naming concept. So we chose Navigating Dementia. As we were deciding on a name, we took a step back and asked ourselves, what are we hoping to achieve with this group? We all mutually agreed that we wanted to help caregivers navigate their own situations and experiences with their loved ones that have dementia through the resources we were going to provide. So we also knew that word navigate could apply to any group name we create in the future, because our goal would be to help patients and caregivers navigate a specific disease or health condition. So we branded the group as a Mount Sinai Health System community for caregivers. And in our group description, we mentioned the connection to Mount Sinai and the Department of Geriatrics. And our next step was working on our response library and escalation protocol. As a health system, we have a response library in place that helps us address messages or mentions about patient experience, billing, or other inquiries related to patient care. So one of our important goals is to protect the privacy and the safety of our group members, which meant minimizing risk through any group messaging. We also have a process if our health system, staff, or patients are threatened or at risk. So in collaboration with our legal teams, we developed a response library specifically for this private group. So if any messages needed to be escalated to larger health system teams, our process was in place. A key component to an engaging group is content. One of our main objectives was to get group members to begin sharing their own experiences and connect with one another. However, we needed to initiate that conversation and essentially break the ice amongst the group members. We hosted an online event where group members got to meet one of our geriatricians in real time on Zoom. They had submitted questions ahead of time to start the conversation, but once the group members felt comfortable enough in this private forum, the event basically ran itself. So from then, our group members grew, as did the community engagement itself. Group members were now posting questions, concerns, and their own feelings that they have been dealing with as caregivers. So with the group postings that were being shared, we made sure to provide adequate resources for the group members, whether it was in the form of an infographic, a video, or a link to a resource on our website. We also made sure to connect to broader themes, as we mostly do in social media marketing. So we developed content around Dementia Week and other health awareness events related to our group. Next slide, please. So after implementing this plan, you might all be wondering what our results are. Next slide. In the first 10 months, we've acquired more than 1,300 new members, 75% of them being female. 657 of those members have actively participated in conversations in the group, and over 900 posts were shared, including research information, videos, infographics, and personal stories and experiences. Next slide, please. And with that being said, we want to share with you some of the group engagement. In the next few slides, you're going to read comments from our group members themselves. Next slide. I'm emotionally exhausted. I have nothing left for myself, my husband, or my children, who both are leaving for college in a few weeks. No one even asks how I'm doing, and I feel guilty for even writing this. So as you can see from this caregiver post, they're opening up about feelings that they might be too afraid to even share with their family members or friends. And it also validates those feelings of loneliness in the caregiver phase. Next slide. I'm really struggling right now. She's only 73 and I'm heartbroken. I don't know what else to do. I'm hoping that maybe it will help with the lashing out. In this quote, this caregiver has joined this group in hopes that fellow members will help guide them through their experience. Next slide. I was wondering if anyone has any suggestions on how to help my mom not be so difficult when she doesn't remember things. She gets very angry and nasty to my dad and I and acts like she is right and we're wrong. So as we transitioned into this quote, we also have group members asking questions on how to cope with certain situations they find themselves in with their loved ones. Next slide. I would like someone to help me on how I can deal with her. I try to tell her I will look for her if it's in her room and she gets madder. Even she gets mad with me, not talking to me for 2 weeks. Please help. Caregivers are searching for answers because they often don't have the adequate resources to deal with the emotional burden that comes with caregiving. And now I'm going to turn it over to Danny, who's going to share with you our next steps for this program.
So some of our next steps are evaluating, as Chloe said, the progress of the group to date. So if you go back to our five strategic initiatives, the TFD, Think, Feel, Do, has been delivered, as you can see from the quotes. The 1990 has been blown away because 36% of our members have been active at one time or another in the community. So we have managed to hit the target. We've managed to strike resonance with the content. And next, we managed to get 10% of the members of the group to engage with the hospital, either by seeking a doctor or setting an appointment. So that opening the door to service line marketing has also been accomplished. So as you think about this, go back to the mandate, do something different, super serve an underserved population. We've managed to achieve that in a very strong kind of way. And when you think about the naming convention, Navigating X, it can apply to any number of different conditions or disease states or service lines. So you can imagine a diabetes community, a maternity community, a joint replacement community, and other kinds of things where you can leverage the benefits and leverage the strengths of your hospital organization. In addition to that, our next steps are also to begin to find new ways to continue to engage the population. Quizzes, polls, videos, infographics, live events, question and answers, ask the doctor, all are in our pipeline to make this a continuing robust community, continuing to resonate with our population, continuing to super serve these people who are desperately in need of help, of sympathy, of expertise, and of care. We hope that this has given you a sense of what we think is the next must-have marketing tactic. If you're interested in discussing this further, ping us and we'll give you our community building checklist absolutely free. Thanks for joining us today. We hope we've given you a sense of this must-have marketing tactic. We wish you the best of luck.
Thank you for this opportunity.